Hello friends, this is Dr. Ateet Sharma, Senior Joint Replacement Surgeon, KD Hospital, Ahmedabad. Today we will discuss about something new, unicondylar knee replacement, which is also called partial knee replacement or microplasty. What are the stages of osteoarthritis? It always begins from the inner side of the knee, the medial part. This is the first stage of arthritis, with burning sensation, pain, and slight difficulty in walking. This then progresses to stage 2, where there is medial and patellofemoral joint OA, in which there is difficulty in climbing upstairs and downstairs, progressing to global OA, in which there is severe pain and severe difficulty in walking. If the patient comes to us in stage 1, which is the medial joint OA or the anteromedial OA, then we can offer unicondylar knee replacement. If the patient comes to us in stage 2 or 3, where a good amount of joint has been damaged, then we cannot offer unicondylar knee. We have to do a total knee replacement. What is the concept behind unicondylar knee? If one part of the apple is damaged, then we do not require to remove the entire peel. We just need to remove the part which is damaged. Similarly, in your car, if one tire is damaged, you don't require to change all the tires. Only the tire which is damaged is to be changed. What are the differences from total knee replacement? This is a smaller joint, and so the incision is small. The incision is almost half of what we do in a knee replacement, 6 cm in UKR, while it is 15 centimeters in a total knee replacement. No muscles or ligaments are cut, so there would be less of blood loss and the patient can return back to work early, faster rehabilitation. 75% of the normal bone is saved, which can be used later on, and only 2 to 3 days of hospital stay is required. What are the other advantages? Less bone loss, we are saving 75% of the normal bone. Less pain as the incision is very small. Very less blood loss because no muscles are cut. Less hospitalization, 2 to 3 days. No physiotherapy as we do not cut any ligaments, and less expensive because you can return back to your job early. So in this case, less is more. What are the other advantages? More natural feeling. It is more safe because we do not enter the intramedullary canal just like we have to do in TKR. So the chances of embolism are very less. More movements, up to 150 degree of movement. You can see the photographs. Patients can sit cross-legged. They can even squat. More preserved biomechanics, more flexibility, more stability, and more satisfaction. I'll show you a few slides ahead. This is how it is done. A very small incision as in photograph 1. The photograph 2 and 3 show the small amount of bone which needs to be removed. The fourth one is the implants of the unicondylar knee, and the last one, unicondylar knee implants in place. This is the post-operative X-ray. Only one part of the joint is changed. The other part of the joint, the lateral side, which is normal, has not been replaced. What is the survivorship data? 98% survivorship in 10 years and 91% survivorship at 20 years. So if I do 100 UKRs today, that 91 of them would be surviving at 20 years. And this is similar to total knee replacement. The usage, if a center is doing 4 unicondylar knees a year, then their results are not so good. If a center is doing more than 50 a year, then their results are excellent. We at KD Hospital have been doing unicondylar knee since 2013. We have done the maximum number in Gujarat and Western India with excellent results. So this is not a replacement. This is a simple resurfacing of the damaged medial compartment of the knee. What are the age criteria? Our youngest patient was 42 years old and The eldest patient was 85 years old. You can do it at any age. What activities can be pursued? Almost all. You can sit cross-legged, you can even cycle, and you can also swim. There is no activity which you cannot do. What happens to the normal lateral joint after UKR? You can see the X-ray, only one part damaged. This is stage 1. If we do not do anything at that time, then as per the arrow, red arrow, the joint will subluxate and the whole joint will become damaged. But if the patient comes early and we do a unicondylar knee, then the joint gets balanced and the lateral part does not get damaged at all. It remains normal. So what you should know before you go? No extensive investigations are required. No blood transfusion is required. It is a 35-minute surgery. Bilateral knee replacement can be done together, unicondylar knee. Only 2 to 3 days of hospital stay required. No home physiotherapy, and it is not for some time, it is forever. So it is not a stopgap surgery. A 15-year of follow-up of one of my patients. This were first generation implants used. She is still walking well, enjoying her life. There are no complaints at all. Now we are using third generation implants, which are much better than these. High level of satisfaction, as I told you. This was a patient whom we did a bilateral UKR. She sent me this photograph, completed 5 kilometers in Motive Charity Walk today. This is another patient, 42-year-old, walking well in the hospital itself. We did a bilateral unicondylar knee, sitting cross-legged. This is another patient, 65-year-old male. We did a bilateral UKR, walking comfortably even when he is at the hospital. This is 60-year-old lady, slightly heavy. We did a bilateral unicondylar and she is pretty happy. This is Dr. David Barrett, with whom I was there in Southampton last year. He is the designer surgeon of unicondylar knee replacement. Presently, out of the total knees which he does, half of them are unicondylar knees, and with excellent results and high satisfaction rate. So what should we know before we go? Be in time, know your options, save your bone and secure your future, pay less and get more out of your surgery. This is the hospital where I work in, friends. Thank you so much for listening to me. Hope you have enjoyed the talk fully. Do subscribe to our YouTube channel, Dr. Ateet Sharma. Thank you once again.